You'll see that, in fact, from a patient's point of view, everything that was raised this morning is all about really deciding to take that embrace that the BMG was talking about already in 1999. And I was commissioned to speak about patient partners. And of course, it's very difficult to do that without bringing up the context of patient partnership, because they go together. Patient partners are all of us. And of course, if you wish, we can, and I had hoped that I could bring a recipe, but I can't. So if you wish, we can go through the various winning conditions that eventually are necessary in order to consider patients as partners and for patient partnership to be successful. And of course, as I was saying before, both go together. So of course, the first one, and that we've been discussing all morning, is the notion that we need to reveal the different dimensions that actually unveil that actually tie together patients and clinicians. And those dimensions are not just about patient-clinician, not just about patients in their own care, but also about the fact that patients can actually officially become co-partners, co-builders of content. They are already co-constructors of their own health. And that is something that we cannot stress enough. As you heard, I've been living as a natural caregiver for the last 25 years, 5 years with, I became a full-time patient myself. And the time, the effort, the energy, the rules to follow with medication, and various other things that it would be endless to mention, make me a co-producer of my own health. And so that is the basis that we need not even to discuss, but to lay as a groundwork. So if we're keep on trying to see what can be the different criteria needed to have patients as partners. Already Karine was saying there needs to be selection criteria. One of the issues that's been raised before is that patients tend to only speak about their own health experience and about the quality of food in hospitals and various other things. So there's also been quite a lot of issues in Quebec specifically, because since the end of the 1990s, we've had the creation of users committees in all health institutions. And so the result is that there's been quite a lot of discussions about, are patients part of the users committee? Can they be patient partners? And so for those reasons, because advocacy is something that is part of patient partners' goals, but also because it's not the first thing on their agenda as they feel that they need and they want to contribute constructively to healthcare situations. So there needs to be differences. And for that, there needs to be rigorous selection criteria. Am I going too fast? No, it's okay. So the third one is going to be, of course, the idea of adapting to patients' needs, and that I will go into the details in a second. To advocate mutual training, and of course, that can't be stressed enough either, training for patients, but also for clinicians. To clearly define roles and responsibilities and ensure strong leadership. And of course, this is a funny exercise to try to put on a list, on a PowerPoint, the main elements needed. We could go in many different directions and go from 6 to 1 if you wish. The idea is to keep in mind that those are the main criteria that we should be working around. Now, of course, raising the question of patient partnership, we need to raise the question of the paradigm shift. If you have a patient that sees those kinds of comments, please don't waste the precious doctor's time with questions, then we are underlying here the question, the notion that patients' questions are not relevant and are not appropriate. And there are many reasons why we see that taking place in the health system. And one of them is the fact that there are so many constraints, and be that only just in terms of time and in terms of needs. But of course, we need to shift away from that perspective and change our mindset. So that also means that patients are more than simple consumers of healthcare. Surveys are great, focus groups also. Patients can be questioned, they can be on focus groups, they can go to, they can write as many surveys as they wish. We need to go beyond that in terms of the relation with patients and to actually not just ask them for their point of view, but really co-build the healthcare institutions of tomorrow in order to be able to speak about patient partners and about patient partnership. And a simple citation to illustrate how this is something that is actually a reality, not just in Quebec, not just in North America, but also in, we could say, the Western world minimally. We need to go beyond that kind of one-way relationship and to also move beyond the dichotomy between us and them. So I need to go faster. Of course, it's not all patients that can be partners, and rigorous selection criteria doesn't necessarily mean that we need to go back into the childhood of all patients, as is illustrated in the drawing. But it's about understanding where the patient is in relation to his or her own health, and understanding or being able to give the opportunity to patients to be to become not just partners, but to enter into an egalitarian relationship. So, of course, universal access is something that we can laugh about. I am now in a wheelchair. It's been the case for the last few months. Before I could walk, but it was more difficult. So, of course, having meetings, up the flight in a room that's up 3 levels of, and it happened with Alain, actually, is something that we don't think about, but it can be as simple as that. As an 8:30 meeting means that you use paratransit, it means that you need to wake up at 5:30 in the morning. Difficult in many cases. But this is nothing new to any of us. It's just simply to be reminded that in order to not to forget any of those criteria, we need to advocate mutual training. And mutual training is also about being able to enter into a real relationship. That implies also having a common language that, of course, I like the expression peopleizing the numbers. It can be the medical jargon, but it's all about the same reality, having a common language that allows us to be able to, as patients, work with the system and within the system, and not one without the other. And for that to happen, we need to provide support. We as patients, we as clinicians, and as healthcare institutions. Now, of course, we already discussed the idea of roles and responsibilities. I think both patients and health clinicians can only benefit from having clear and defined goals and clear ways to attain success. And merely having a patient around the committee is not sufficient. Again, I feel like I'm repeating myself. And of course, we can't discuss patient partners without raising the issue of fears. And it's not out of facility that I'm doing that, but it's simply because it is the reality of the paradigm in which we do function. Fears are very present. They are embedded in the way patients see doctors, just as they are embedded in the way clinicians see patients. And of course, the advent of the internet has not helped in that sense, or has helped in the way that it's fueled even more of those fears. And Dr. Google is someone that everybody knows by now, okay? Everybody is worried about that situation. So I was participating in Memphis at a seminar from the IPFCC, and Bill Schwab was saying, well, to have patients as partners implies collaboration. Again, we are saying very simple things here. We're talking about mutual respect for skills and knowledge, because if patients are recognized as co-producers, then their experience-based knowledge needs to also be recognized. So we are talking about complementarity. We're talking about clear communication, understanding and empathy, mutually agreed upon goals. And to finish my presentation, well, you know, we can speak about impacts also at length. We can speak about the impact on the patient's health, on healthcare workers, be that staff or clinicians. And also we can speak on the impact from an economical point of view. All of those need to be considered when we're talking about patient partners. Thank you.